It does come down to the old boarding advice that your grandma gave you about diet, exercise, all those fun things that we all love to hear. That really is the key. Just an overall sense of health and good habits are really going to be the thing that's going to keep erections around the longest.
I
So
love that. So what's good for your heart is good for your penis. Welcome to the Get Your Marriage On podcast. I'm your host, Dan Purcell, a Christian marriage and intimacy expert and coach. I'm on a mission to help couples have the best sex and most emotionally intimate marriages possible. Our episodes cover topics you've always wondered about and are packed with practical advice designed to help you take your marriage to the next level. I've been looking forward to this podcast episode for many months. As I think ahead to my 50s, 60s, 70s, and 80s and beyond, I want to have a healthy and vibrant sex life. I want my body, especially my penis, to serve us both in creating pleasurable and intimately connecting experiences for many years to come. Lots of men, and I'm in this category too, really like their penis and get concerned when it doesn't function as they expect. Good, strong erections are indications for a man's health and vitality overall, as well as a means to pleasure too. Many men and their lovers have questions about erectile dysfunction, lasting longer in bed, testosterone, and much more related to men's sexual health. So how do we take better care of our sexual health? And when we get sick, how do we get better? My guest today is Joshua Savage, a friend of mine who is also a urologist. Thanks in advance to many of you that shared your questions about male sexual health via our Instagram account. We're going to address those in today's episode. If you don't follow me yet on Instagram, I recommend pausing this episode, opening Instagram, and search for Get Your Marriage On. There's a lot of great content there and some funny reels too. After listening to this podcast, you might have questions about your own sexual functioning from a psychological point of view. If you're interested in getting coaching to help you through any mental struggles interfering with all the pleasure you could be enjoying in your sexual relationship, or just conflict in your relationship in general, contact me about marriage coaching. It's like getting a personal trainer for your marriage and for your sexuality. And remember, you're just one coaching session away from a more meaningful, pleasurable, and intimate sex life. Which leads me to my next point. Getting away for the weekend once in a while with your spouse can be really nourishing for your marriage, especially if it's a marriage retreat where you learn about how to have more fun and a more intimate and connecting and fulfilling sex life, where you can also develop closer friendships with other couples there. You can also learn new skills that help you deal with conflict and other challenges that arise in any marriage. And most importantly, to have fun, a little bit of a vacation, and just really relax and enjoy each other. Our next retreat is 4 days long and 3 nights, October 26th or 29 in the Dallas-Fort Worth, Texas area. Registration is open now, and you don't want to miss it. So go to getyourmarriageon.com and click on retreats and then DFW retreat. Dr. Joshua Savage, welcome to the Get Your Marriage On podcast. How are you today?
hey, doing great.
So you're a urologist, and I gotta say, it takes a special breed of person to be a urologist. What got you interested in urology?
Yes. So I'm actually a urology PA, so urology physician assistant, and it's kind of an interesting story. It was kind of an organic process. So it started a few days before my wedding, right?
Of course.
Yeah.
Using certain things on your mind.
Yeah, right. Exactly. So just trying to impress my fiance at the time. We were doing some lifting some weights. So
Get in honeymoon condition.
oh, yeah, that's right. Gotta impress the female species, right? So put a little bit more weight than I usually did on the leg presses and things and pulled something, which I thought, oh, that's kind of weird. And so sure enough, I wake up on my wedding day and I got some intense pain. And I thought, oh no, like worst day ever, right? To have something like that happen. So I try to rush over to, I was going to BYU at the time, went to the old BYU, health center. They rushed me and I kind of explained the situation. Hey, look, I got my wedding to go to. And so anyhow, so they gave me some pain pills and stuff and and that helped fortunately. But I was late to my own wedding. So yeah, so I was late to my own wedding and it went away, but then kind of still had a little bit pain here or there. They ended up sending me to a urologist and so I met actually with the urology PA and he just kind of heard that I was going into looking into PA school and things. And so he suggested, hey, you should look into it. Urology, it tends to be a little bit more of a family conducive lifestyle, which interested me. And he just talked about how it tends to be more of a, sensitive area. So, if you can really listen to someone and help their problems, a lot of times they've been blown off. And so he just talked about, the high satisfaction that he got from his job, and it appealed to me. So I ended up doing a rotation in PA school on it and liked it. Ended up in urology department at Mayo Clinic for about 8 years. And that's where I met Dr. Landon Trost. So he is the doctor I work with. And we're now here in Utah, just a small little clinic called the Male Fertility and Pronies Clinic. So we primarily focus on male fertility and Peyronie's disease, which is a bent penis condition, but inadvertently deal a lot with testosterone related issues, things like that. So
That's great.
yeah.
So that was the kick in the balls that got the ball rolling.
Yes,
Being,
the kick. Yes, that's what got the ball rolling. Into this field for me for sure.
That's so good. Well, so to prepare for this episode, I reached out to my Instagram audience and I asked them, what are your questions about male sexual health? And I got tons of great questions.
All right.
So I've got a lot for you today. Ready?
Yeah, let's go for it.
Sounds good. How do I get hard, long-lasting erections?
Yeah.
And why does someone want a good, hard erection?
Yeah. Good question. So, the male body is designed to kind of take care of this on our own, right? It's kind of thrown onto us whether we want it or not during puberty, right? But really ultimately what it comes down to in terms of longevity, and I think it's probably helpful to break down like this. So there's, less than 40, which is kind of a rough divide, versus over 40 in terms of maintaining healthy, good erections. So
when you say 40, you mean age 40?
Yes. Sorry, age less than 40 versus greater than 40, which is kind of a crude differentiation. And maybe if we use extremes, it's better, because sometimes I will see guys in my clinic and they're, 20, 22, and they're having erection problems. And almost always the typical patient that I'm going to see like this has a history of anxiety, depression. And what'll happen is it starts kind of creating this snowball effect where, maybe something legitimate did happen. Maybe they're on a medication and they had erection issues, and that starts kind of creating a snowball effect in their head, like, oh my goodness. And maybe they're embarrassed by their partner. They went to have sex and they couldn't get an erection. And then it kind of gets stuck in their head. And what starts happening is they get this, what we call like a spectator type phenomenon, where they're so anxious and worried, like, oh my gosh, am I going to perform? And then to compound it, maybe their partner doesn't understand. And then they're offended, like, oh, you don't find me attractive or something, or
yes,
it just, makes it even worse. And so literally what's happening, we call it a hyperadrenergic response, meaning the whole like fight or flight response starts kicking in, because when you're feeling anxious, that's what kicks in, and so instead of trying to have sex, your body's trying to run away from that bear. And when you're trying to run from a bear, you don't want an erection,
no.
Not the time, So anyhow, so it almost physiologically makes it impossible to get an erection in these cases. And I think it's easy sometimes these younger 20-something-year-old kids come in and talk about erection issues and kind of get blown off a little bit. And while it's technically true, it's all in their head, but obviously that's not going to help someone dealing with this, because it really does create real responses, real pathways in the body, and they can get very stuck in those pathways, and it gets very difficult to overcome that. And so, and there's a whole slew of treatments you can do for that. There's, sex therapy, things like that can be helpful, but really anxiety management and trying to work through this with a therapist is the best thing in those type of situations. Sometimes we'll use like a short-term like medication such as tadalafil, which is the Cialis, or sildenafil, Viagra, just kind of as a short-term measure to kind of build their confidence that, hey, things are working still down here, right? And then ultimately, I think what the therapy comes down to is realizing that, hey, you know what? If I don't get erection, we're still sexual beings outside of just our ability to get erection. That doesn't define our sexuality. And there's still a lot of other things you can do sexually without erection. And that tends to help these patients the most as well. And that kind of helps the anxiety kind of go away over time, right? It's not an instant thing, but, do other things that are sexual that don't involve erections for these younger guys. Now, for the older population, not older, right, but 40 and above, so very, very common, right? So half of guys age 40 to 70 have some degree of erectile dysfunction. And part of it's age genetics, right? Now, that being said, there are things that we can do to maintain, our best capacity for erections. Like I said, there's just kind of some genetic bad luck with us all. But in general, vascular health is very tightly linked with erection health. And a times it's kind of been looked as the whole canary in the coal mine thing, where it's the warning of future issues, right? So if a man has erectile dysfunction, and again, this is not the 20-year-old population, this is the 40 plus, but if a man has erectile dysfunction, he's twice as likely to have hypertension or high blood pressure. He's twice as likely to have cardiovascular disease, 3 times as likely to have diabetes, right? So all these conditions that you would think normally a cardiologist would talk about, but a lot of times things like high blood pressure that nickname is called the silent killer, right? And whereas erectile dysfunction is not, right? And so guys notice, their partners notice when they're having erections. And so cardiovascular disease, diabetes, high blood pressure, these things are all the things you're not going to notice, right, when you first get them. Whereas erection issues, you start noticing pretty much right away, right? So really, bottom line, anything that's good for your vascular health is going to be good to maintain good natural erections as long as your genetic line is designed to carry you, right? So diet, maintaining a healthy exercise regimen, keeping blood pressure under control, watching your blood sugar levels, in particular if you're diabetic. Diabetes is really hard on erections, 3 times as likely, right, if a guy's erectile dysfunction to be diabetic. It's just the diabetes, elevated blood sugar is terribly damaging to our vessel. And especially in uncontrolled diabetics, it's really just a matter of time before they get erectile dysfunction with it for the most part. Now, if you're very diligent with blood sugar levels, things like that, that definitely prevents it, helps out a lot. But uncontrolled is just so damaging. All of the boring stuff. I do get a lot of questions about, oh, tell me some magic fruit, to eat or,
Uh
like
huh.
that. But really, it does come down to the old boring advice that your grandma gave you about diet, exercise, all those fun things that we all love to hear.
Yeah, yeah.
But really, that really is the key. Just an overall sense of health and good habits are really going to be the thing that's going to keep erections around the longest.
I
So
love that. So, what's good for your heart is good for your penis.
yes, definitely. Yeah,
That's a
we should
great motto.
sticker about that shirt. I should. So
What role does tobacco, marijuana, or alcohol play in a person's ability to have erections?
you hear stories, oh, my grandma smoked till she was 90, no problems. And obviously, there's a lot of variations with these things. But in general, like tobacco, for example, is a risk factor for peripheral vascular disease, meaning that the vessels that transport blood get clogged up and things like that, which the penis is really most similar to an extremity, such as your fingers or toes, smaller vessel diameter, things like that. And so they can really be impacted over
Very
time.
sensitive. Yeah.
Yeah, it can really be impacted over time. Marijuana, interesting, it tends to have more impact on fertility than direct erection issues, but marijuana
Okay.
can be a big negative impact for fertility.
Why is
Uh,
that? Does it impact sperm production?
so we're not exactly sure the exact direct connection with it, which is true with a lot of medical stuff, but I've definitely seen it in my clinic with guys with fertility issues, and again, it tends to be related to the frequency of marijuana use and the amount of the marijuana use and the time duration of marijuana use. But I've definitely seen it directly impact significant on motility or the amount of sperm that move and just the overall number as well. And again, there's going to be individual variations with these, but in general, I definitely, if there's a couple trying to get pregnant and they're on high doses of marijuana, it's definitely something I recommend stopping completely. Same with alcohol. I mean, again, there's going to be individual variability there. Alcohol can impact fertility a little bit as well. And then, and again, depending on dose dependent, can impact erections as well there. So,
Mm. Having a big, hard erection is really satisfying because, when that skin is stretched tight, you're big. There's more pleasure in sex because there's more surface area for your
yes,
nerves to pick up reception and whatever.
for sure. For sure.
And for some people, they struggle with premature ejaculation.
Yes.
It's too sensitive.
Yes.
Anything you do to treat or anything we need to understand better about premature ejaculation?
Yeah, there's really kind of two major factors here. And so, of course, as a medical professional, I deal with the medical side of it. But then there really is a whole psychological component to this
Yes.
too,
Mhm.
that, I definitely am aware of, but obviously I don't have the time, unfortunately, and or the skill and expertise to really tackle the
Psychological side. It could be psychological.
head
Yep.
on, right?
Right, right. But if it is psychological, come see me. I'm a coach and I can help you through it.
Yeah,
But
there you go, there you go. So there's
but if it's
definitely
a medical issue, you
yes,
want you wanna see a
yeah,
specialist. Yeah.
yes, but definitely psychological issues, again, highly correlated with people with more anxiety and different psychological issues like that, that can definitely be an impact. Now, that being said, there are some physical factors that can be at play, and just some checklist items that you can try, go to the store, pick up a few things. So, the first one's the easiest. So, if a man has a full bladder for whatever reason, they tend to ejaculate quicker. So that's kind of a simple, straightforward one. Urinate prior to sexual activity. And like you said, that there can just be, a physical sensation of too much or too sensitive in the area. So there's actually some topical sprays that are available on the market. So probably the most prominent name brand is one called Promescent. And it's basically a topical spray. So you do a few sprays, let it sit for, 10, 15 minutes. Unless your partner also wants to have the effect, usually you kind of wipe it off with like a towel, prior to sexual activity. So that can be helpful for some people. And again, a lot of people don't like these as much, but condoms, it does provide that additional just layer to create less sensitivity. And of course, it's up to the individual couple or individual what they decide to do. You could use a condom for the first, period of sexual activity until maybe you're ready to take it off and, have a more intimate experience, right? So, yeah, so condom use is another one. There are prescription medications because, of course, there's a flip side, which we may talk about, but there's, delayed ejaculation or
Yes,
inability,
we'll get there. Uh-huh.
which is usually medication related, but we can use some of those medications and their, quote, side effects as a side effect that we want, and so there are
Yeah.
medications. So a common one would be, uh, you know, antidepressants, interestingly enough, or antidepressants such as Paxil is probably the more common one used for premature ejaculation because it tends to not linger in your body as long. And so usually you can use it prior to sexual activity and use kind of its beneficial side effects to last longer.
Those
So
are short-term those are short SSRIs, right? They
SSRI, so
Mhm.
commonly used in depression. I should say this too, that one of the other things that we focus on with premature ejaculation and erectile dysfunction go hand in hand. And so that's the other thing. Sometimes I will give like a Viagra or sildenafil, tadalafil, Cialis, something like that in a guy with premature ejaculation because if you can get an erection quicker, then you can last longer with, say, like sexual intercourse, because yeah, you needed less stimulation to achieve an erection, and so then you can last longer with maybe an activity that'd be more enjoyable for you, right? So
Right. Because some of the mentality behind premature ejaculation is, "Oh, I got my erection," and you kinda freak out, "I gotta hurry up while I have my erection before it
right,
goes away."
yes,
And so it kind of feeds that cycle of learning to
for
go
sure,
quick. Yeah.
sure, yeah, and
So
I'll
lasting longer.
stand up for the men of the world here because yeah, I think sometimes men kind of get this like, oh, it's just this easy on off switch, and women are this complicated thing, and which I mean, I think there's some generalities that maybe
Uh-huh.
could apply there,
There's a lot
yeah,
of humor in that too, but
yeah, yeah,
men
yeah,
are just as complex,
yeah,
in our own right.
yeah, exactly. I mean, and then in general, I mean, okay, I mean, it is bam, bam. Sometimes a lot of guys were, immediately sexual stimulation erection happens. That's great, but there are definitely a lot of factors here that go into this psychologically that definitely get complicated really quick. And it definitely doesn't help that the societal norm is that men are just supposed to be these sexual machines that just perform all the time at the drop of a hat, and
Right, right.
can be true, especially if there's other issues going on at play. The societal norm definitely doesn't help the psychologically impacted individual with these type of issues.
Yeah. Now let's talk about the opposite problem,
Yeah.
delayed ejaculation. You talked about how oftentimes, like, medications get involved in that.
Yes. Yeah.
Any
So
other medical factors that often get involved in that? Or
yeah,
is it
yeah.
mostly psychological there?
Yeah, and again, there's kind of the two factors here. Definitely can be psychological. Most commonly, what I'll see with this, again, it could be funny enough, same thing as the premature. It could be erectile dysfunction because, like you said, if you have a natural good erection, then yes, that you feel more stimulation, it feels more gratifying, and so while a man can actually ejaculate an orgasm without an erection, it definitely is more enjoyable for most men and a lot easier if they do have an erection. And a lot of guys, you know, say they did have a surgery that impacted their erections. One of the more common ones that I dealt with was a prostate removal due to prostate cancer. It can be impossible for men to get an erection in those cases, and some men just kind of give up and kind of label it as, well, I just can't, ejaculate anymore, which that could be true, but not always, right? And so
Right.
so a man still can orgasm without an erection. Oftentimes, the most common scenario I run into, though, by far, is medication related. So the antidepressants are very common impacts on this. Now, there are a couple that are less impactful. So Wellbutrin or bupropion tends to be less impactful on ability to ejaculate, as well as Remeron are the two big ones. Now, these are prescriptions. I'm not a medical or a
Mental health.
yeah,
Like you're not a psychiatrist or whatever. Uh-huh.
yeah, exactly. So, take these two, maybe talk to them, see what they think, see if they'd be a good fit for you. Because I mean, these antidepressants, anti-anxiety medications, oftentimes people have been on multiple different ones. And so it's definitely not as easy as, oh, we'll just switch this one over. But from a sexual standpoint, those ones tend to have the least impact. Whereas things like Paxil, like I said, we'll use that one to cause a delayed ejaculation in a guy with premature ejaculation. So, yeah. So medications like gabapentin tend to have a big impact. So those are used in like neurological disorders, or pain medications such as oxycodone, like the narcotic type medications, tend to have an impact. Ability to ejaculate. So those are some common medications that can definitely make it difficult to orgasm, climax.
Yeah, yeah. I'm just really curious. Can you teach me how a man can orgasm without an erection? How does that work?
Well, it's more possible in a guy like in a prostate removal, for example, those nerves that innervate the penis that cause an erection get severed or cut, right? And so they can still get stimulated, right? And still feel that sexual pleasure and still orgasm. But it's definitely a different type of, or well, and especially in a prostate removal, because your prostate is what provides the majority of the semen.
Seminal fluid?
Yeah.
Uh-huh.
Mhm. Yep, yep. So, which is a whole nother learning experience for me. I didn't realize, once a guy loses his ability to produce ejaculate, that actually provides a very unique sensation for men too. You're kind of talking about the unique sensation of getting an erection. You don't realize, these men don't realize until they lose the ability to produce semen, that it makes significantly less pleasurable orgasms
Mhm.
in these type of cases. So they still can orgasm. Oftentimes we'll describe it as different, right? And oftentimes not as pleasurable, unfortunately. So definitely most men that come into the clinic are not shooting for that. Like they still want erections, right? They want that, big hard on. They want the big erection too, because there is that sensation involved both with having a firm erection, as well as being able to provide seminal fluid in the ejaculate that also provides a pleasurable sensation in men with orgasms.
Right. And as a surgeon, you assist in people have it's a prosthetic that you insert into the penis and
Yes.
with a pump. Can you describe that for someone who may have never heard about this before?
Yeah, yeah. So most people kind of chuckle, when they first hear about this, but kind of the layman explanation, it's kind of like those old Nike Airs where you like pump up.
Yes, yeah, right on the tongue of the shoe,
Yeah,
right? Pump,
yeah,
pump, pump. Uh-huh.
makes you jump higher, right? Well, this now. So these have been around for quite a while. In fact, it's been investigated for really hundreds of years. But to kind of give like a very brief overview with erection issues, typical first line that I see in my office, these are, typically older than 40. Typically pills is kind of first line.
Like the Viagra's or whatever. Let's see if we can
Yep,
help. Uh-huh.
yep, yep. There's injectables out there that are stronger, but as you can
Is that
imagine,
second line?
That's the
injectables?
second line, yeah,
It's a
so,
little more painful sounding
yeah,
to
as you can
give
imagine,
myself a shot in a sensitive area.
super excited to inject their penis with, but, you know, a lot of guys use it and love them and they work and guys make it work, but yeah, typically kinda last line, last resort, so if a guy's unable to get an erection despite, medical therapies, and again, most of these guys are 50s, 60s, things like that, their body has just lost the ability, and if you took a tissue sample out of a penis, which we don't do this routinely, but, you know, the research when they've done this, the penis actually literally starts changing, right? And so there's less of that smooth muscle that fills up, that causes an erection, and more collagen, which just doesn't absorb blood very well. And so these men become unable, and it's called a venous leak, where the blood is leaking out, going back into the bloodstream too quick. That the penis isn't able to trap the blood into the penis as well. And so in these cases with these men where they're unable, Viagra doesn't work for anymore, injections don't work, nothing works to get a good erection. So in these cases, an option is a penile implant, sometimes abbreviated an IPP or inflatable penile prosthesis, where basically, well, there's a couple of different ways to do it. The most common, I'll talk about that one, but it's a three-piece device where two cylinders are surgically, of course, they're put out for this, but two cylinders are inserted into the penis. A little pump is placed in the scrotum, like inside. It's all internal. So if you're in the locker room, no one would ever be able to tell a guy had one of these. But a little pump is placed in between the two testicles typically, and then a little reservoir of just sterile water, sterile saline is placed kind of by the bladder. So you can't feel that. But so yeah, when a guy needs erection, he gives a few pumps to this little thing in the scrotum and causes an erection that way. And you know, I think most guys kind of chuckle when I first heard that. I kind of did, like, what in the world? But interestingly enough, though, you know, and again, I think patients self-select for this. Some guys say, "Ah, I'd never do that," and you know, I usually tell people when I talk to them in clinic, hey, you know, just it's worth investigating, because guys that do it have very high satisfaction rates. I mean, 90+% satisfaction rates in these studies. And in some ways, sometimes I'll get people, in my opinion, I feel like inappropriately seeking them out, because you become kind of this bionicle man in a way where like,
I'm like Iron Man.
yeah, or well, yeah. I mean, you can get an erection whenever you want. You can get an erection for how long you want. So you can do things that a normal man cannot do. I mean, you know, if you know, a 2-hour erection, sure, you know. So, you know, so there's a lot of things you can do, those you can't. Now, that being said, though, I do always warn patients, because there's always downsides to these. It actually shortens the penis a little bit, and it's definitely not a fix for a relationship either. I feel like a lot of guys come into this thinking, oh, if I just get a better erection, then that'll solve all my marriage problems, which,
Doesn't always, no.
yeah, unfortunately,
If it was only that simple.
yeah. So unfortunately, sometimes it makes it worse, because now the guy's all excited. He's got this new toy. Hey, you know, all excited. And, you know, so definitely some good discussion with both partners, and realistic expectations are really the biggest key take home point with these. As long as a guy has realistic expectations with these, they tend to do pretty well, in all honesty. And surprisingly, a lot of insurances won't cover Viagra, but they'll cover the penile implant. Now,
That's
not every
weird. Uh-huh.
insurance, but like things like Medicare, which most people are Medicare to get these anyhow. Oddly enough, you know, I don't know, they won't cover Viagra, but they'll cover a big surgery to put a penile implant in. So kind of interesting.
So we
Yeah.
talked about different medicines. When I check my spam box in my email, I often see things about there's this pill that if I take, it makes my penis bigger. I can actually have a bigger penis.
Yeah.
Like, and with a bigger penis, I'm gonna, attract more ladies or whatever the line of thinking is. Is that I it I think that's a myth, but can we confirm that? Is there anything you can take or medication that'll actually make your penis bigger?
Medication wise, that I'm aware of, you know, interestingly enough, there's a surgery that's been done by a guy out of Brazil, and not done commonly in the US, because the side effect is your penis could necrose and shrivel
What
up.
does necrose mean? Sure.
Necrose just means that, like, it would cut off all the blood supply to
Oh,
it,
oh, uh-huh.
product, or lose, which penises and blood definitely go together. You need a good blood supply, and
There's
so
risk involved. High
yeah,
risk. Uh-huh.
significant risk with those. So there technically is a surgery, definitely not something I've ever recommended to people just due to the side effects of it. Um, there is a traction device that came out a few years ago. And full disclosure, the doctor work with actually developed the device, but it improves on average by about an inch or so in length. So anyhow, but it's a device, a stretching device that's used for a period of 30 to 60 minutes over about a 3 month period.
So you got to be dedicated for that.
Yeah, got to be real committed, yeah, which some people are, So, but that improves the stretch penile length by about an inch on average. So, but yeah, unfortunately, no pill surgery. Just again, I always just think, oh, if it were me, if I were in their shoes, would I risk, my penis being able to work ever again to get a little bit longer? I mean, in fact, most of the studies actually show that penile girth is actually more of a predictive factor for female pleasure than length, anyhow, which kind of opens up a whole nother can of worms because there's surgeries that have been done to improve penile girth, which again, I'm definitely biased in that I see all the mistakes and complications, but at least for me, I'll just say this: I wouldn't. I've just seen so many issues and problems with. They'll inject all sorts of weird different things in guys' penises, and it's yeah, definitely not natural. And kind of creates this what I'll call a pendulum effect when guys are walking because they have this added girth of this thing in their penis, and just going for a walk or a run makes it very, very challenging. So there's a reason men always don't have a big amount of mass walking around in their pants.
Uh-huh.
Will be a sign of true manliness or whatnot. But it's again not very helpful when you're just looking to go for a run or a walk, and you don't want some heavy mass, hanging down between your legs.
No, get in the way.
Yeah,
Now,
yeah.
as a doctor, you see a lot of penises. Is there any such thing as a perfect penis?
Oh, definitely not. I mean, it's just like any person's face. There's no two that are alike, some bigger, some smaller, some this way, some that. And I deal a lot with Peyronie's disease, which is a condition of the bent penis. That being said, I don't know if there's a perfectly straight penis either. Some penises are bent a little bit to the left or the right or up or down or whatnot. And
And that's normal. It's okay to have some bend.
oh, yeah, for sure, for sure. And the biggest thing that I always try to judge treating someone medically for is how big of a bother, is it for the person? Which again, we're kind of branching off in the psychological aspect because sometimes, with conditions such as obsessive compulsive disorders, things like that, sometimes a man can get too obsessed about a certain component of his penis or things like that don't really impact from a medical physical standpoint. But in general, it's a good barometer to say, okay, hey, is this curvature causing significant problem for you? And if it is, then great. Let's sit down and talk about treatment options. And if not, I mean, hey, we're all different, and let's celebrate that in ourselves and in our partners, and not to be too critical.
Gotcha. Are there any other hokey, I'm going to say that word, like, uh, uh, things, procedures out there that are touted that people should be aware of?
Yeah. So, yes, and I want to be a little careful here. I don't want to offend any people or anything like that. But I will say it like this is that I'm all for future research in medicine. Obviously, that's how we got to where we're at. And I'm always of the opinion I try to approach things humbly that, hey, we still got a lot to learn. And some of the craziest ideas out there turn out to be, what everyone thought was stupid, right? Turns out to be, wow, actually, that was genius, right? And
Right,
so
right.
I'm always
Even
open.
like how Viagra was invented was
Yeah, yeah.
one of
Well,
those things,
yeah,
right?
blood pressure medication, and when guys wouldn't return the pills, they thought, why aren't they returning these pills? So,
Uh-huh.
but yeah, so a couple therapies that I would say need further research in a clinical trial that I don't think it's fair for patients to be spending thousands of dollars to basically be the basis of medications and treatments that don't involve research backed treatments. So a couple ones that I run into a lot would be like the shockwave therapy. So I just looking this morning at the most recent meta-analyses on these, and this would match up with my own clinical experience where occasionally I'll get a guy that says, oh yeah, helped a little bit, but definitely there's no research out there showing long-term benefit. So So great, let's get some more research out there. Clinical trials either reimburse people, right, or do it for free, right? So they're not having to invest thousands of dollars in something that still hasn't been clinically proven. Because I think that's kind of how it's touted sometimes, like, oh, well, don't just treat it with a pill or don't put a band-aid on it, cure it, and these
It
uh,
sounds great.
yeah, the shockwave definitely not a cure. Same with, there's like stem cell injections or platelet rich plasma injections, things like that, which again, I think some of this research is definitely a good idea. There's been some restorative, regenerative therapies of the penis, and I think that's kind of the future, really, of erection issues as well as other issues, say like kidney failure, something like that. Hey, can we regenerate, grow a new kidney for someone, or regenerate, regrow, or grow penile tissue for a man, right? So that's kind of the future of erectile dysfunction treatment. Unfortunately, we're not there, and more clinical trials need to be done under the supervision of a medical board, things like that. So that would kind of just be my caveat with all that. I'm all for those things, but definitely it's not prime time, ready for those things quite yet. And again, my opinion is just mine, but I always try to think, oh, would I want to spend thousands of dollars on this treatment? I just wouldn't. I think there's cheaper nowadays. When I started, I've been doing this for over 10 years now. When I started, Viagra and Cialis, they were all name brand only, expensive. And nowadays they're generic, pretty inexpensive. And
You
they,
said there's even like an over the counter that's just FDA approved.
yeah, this was recent and just recent over the past couple of weeks. So it's called Eroxon. Um,
Eroxon. Yes, that's a
yeah,
great name.
yeah, Eroxon. So
Rocks on.
right. Yeah. So the clinical trial's not back on that. So we're still kind of waiting to see. It did get FDA approved though, for use. So at a minimum, and they've talked about this too with like sildenafil or Viagra, making it over the counter. There are issues with it. There are potential side effects like with anything. So I'm not saying that, but in general, they're fairly safe medications. So there's been some talk about making them over the counter, but right now they're still prescriptions. So anyhow, so they got clinically approved with the Eroxon to be over the counter, which is kind of a huge kind of game changer. So we'll see. I don't know. We're still waiting for the official clinical trials. We need the actual data. Unfortunately, I was just looking up. It's been available in England. I was looking up some reviews, and I was kind of getting mixed reviews from what I was seeing. So I don't know. We'll see. It has some promise. It has some promise, right?
Awesome. So, Josh, where I live, I see a lot of T clinics popping up everywhere, meaning they help men with low testosterone, providing injections and such. It
Hmm.
seems like a really lucrative business because I understand once you start testosterone replacement therapy, generally speaking, you're on it for life or for a very long time because it interrupts your body's natural ability to create testosterone. I just want to know if you're worried about low testosterone, are there any natural ways you can do to increase testosterone just through lifestyle?
Yeah, there's been a lot of talk in the news and the media, like about the obesity epidemic, and that definitely has a direct correlation on testosterone. And it's not just obesity, right? Just being overweight. So part of how our bodies work is our fat cells aren't just passive storage for calories. So they impact things in our body, which is why the reason there's health concerns with it, right? So one of the things that our fat cells do in our body, though, is it breaks down testosterone into estrogen. The normal testosterone range is anywhere between 300 and 950, which is a big range, and it doesn't tend to correlate with much. Now, body weight it does, right? So if there's a guy, that does have a low testosterone, say he's 150, 200, something like that, and morbidly obese, and it becomes a little bit of a catch 22, in all honesty, where low testosterone, your body tends to make less muscle mass, more fat. And so if you're obese and low testosterone, there may be a role for testosterone therapy in the individual. Ultimately, though, again, I always try to put myself in their shoes. What would I want? Like, well, I tend to prefer to be on the least amount of medications possible, right? So I would personally like to get off the testosterone as soon as I could, right? Once I got to more, normal body weight. Now, interestingly enough, testosterone, it's not a weight loss drug. So people do gain muscle mass, about 3 to 4 pounds per year that they're on it, and lose about that much of fat. So, but the overall body weight's the same. So you got to do other things to actually lose weight overall. But but yeah, I see a lot of patients from the testosterone clinic, but in my experience in talking to these people and seeing where their labs are, if they follow the current testosterone guidelines, a lot of these men would not be supplemented based on the current American Urologic Association guidelines. So I am also a little leery. And again, I'm mostly just going off what patients come in and tell to me. But in general, I would be cautious. But someone is kept within around 600 is kind of the recommended. So kind
When you
of
say
back
600,
600. Yeah, it's the blood.
that's a measurement, right? In a blood test, you're at a 600 for your test.
Yeah,
That's the
600
free testosterone or whatever.
milliliter technically is how it's measured. But yeah. So again, the guidelines purely go off total testosterone. And then the guidelines suggest supplementation only if a man is symptomatic, which I feel like we could do a whole episode just on this because, symptomatic is kind of interesting too, because a lot of the big things they market for testosterone, such as low energy or I'm kind of foggy thinking. In,
Depression. Uh-huh.
yeah, those. So in particular, energy and kind of this foggy thinking they tend to correlate least with improvement in testosterone therapy. And so things like ability to get an erection, sex drive, libido, depression, actually, those have been shown a little bit more consistently to have benefit with testosterone therapy. And again, though, we got to keep in mind, though, backing up that this is men with testosterone lower than 300 milligrams or 300 nanograms per milliliter, or I use just a total testosterone of 300, less than 300. And then this is supplementing them back to safe levels, which is typically around like 600 is what the guidelines suggest. Because I will see patients coming in. And again, this is related mostly ideal fertility, right? And so men have been inappropriately told that, oh, testosterone will boost your fertility, or oh, it won't be a problem. And in fact, testosterone has actually been looked into as a form of male birth control. And so it can make men infertile, typically temporarily while they're on the medication. Um, and again, I've had good experience with these testosterone clinics too, where they're well aware of this. They say, okay, we need to get you on these other medications such as HEG or Clomid or different things that still stimulate the testicles to make sperm while at the same time supplementing their testosterone. So, but that would be my only caution, I guess, to throw out there is really it should only be supplementing if you're less than a total of 300 and you're having symptoms, which again, the most reliable symptoms are sexual related, are the most or depression related, which again, it definitely talk to your doctor about these because it can be a lot to kind of tease out and figure out what's actually going on here. But definitely only supplement less than 300, carefully monitor levels. You're kind of aiming for around that 600 total testosterone mark is kind of what you're aiming for. Because going above there, will guys feel better? Yes, that is true. And what I would say to that is, well, I mean, there's a lot of medications that I can give to people that will make you feel better, but that doesn't mean that's the best thing. I mean, it's kind of the whole like recreational drug use, right? It makes you feel better, but is it the best for overall health? Probably not with a lot of these drugs. And there are risks, right? With um, I think like a lot of things in life, there's risks with too much of something and there's risks with too little of something. And that's in my experience the same with testosterone as well. Well, there's definite risk with a man having too low. Again, less than 300 for a prolonged period of time can lead to like bone mineral density issues, osteoporosis. It can lead to muscle wasting and hyperlipidemia, what we call metabolic syndrome, which is too much fat, too little muscle, things like that. But then you also run the same risks, ironically enough, with too high. So we love it because it builds muscle in men. But then if the heart gets too big, it causes congestive heart failure, And then, like you said, Dan, your body stops making its own testosterone when you go on it. Now, a lot of times that can be reversed. But in extreme cases, I've seen bodybuilders where their body just becomes dependent on these excessively high doses of testosterone. It becomes problematic because now what do they do? Now the receptors, like you said, have been changed a little bit, and now they kind of need that level. And they go to their doctor saying, boy, I feel terrible. I'm miserable. And they check their testosterone. And even though they're off it now they're at 500, which is normal, but they're still feeling miserable. And so it just, I feel for these guys, honestly. I really do. They kind of get in this stuck spot a little bit. And again, kind of my bias is I'd rather be on as little medications as possible. And in my experience, talking to people, that's how most people are as well. So kind of boring my ultimate advice with this, but you kind of just want to be normal with it.
Goldilocks zone. Not
Yeah,
too much, not too little. Love it. Good. All right. Dr. Savage, this has been such a fascinating conversation. I would just want to know, because you deal with sexual health, men are coming in because they want great sexual performance. Let's say they work with you, they do the diet, sleep, exercise, all the manage stress, all those things. They're living healthy.
Mhm.
And now, so they're up to baseline now. Now they're ready to take their sexual relationship or sexual performance to the next level. I
Sure.
want to know, what are your black belt sex tips?
Yeah. Yeah. Good question. So it's kind of along the same theme as kind of what I've talked to a lot about, I feel like in this episode. In my experience in my own life, and then just talking to lots of patients, things like, well, hey, like I want to explore oral sex with my partner, or, just different things like that. That the best approach I found is yes, be honest, state your desires, things like that. But the more, you get hyper focused, the more you get, kind of really fixated, shaming of yourself or your partner, just things like that. It just tends to compound the issue even worse. And so that's kind of my tip there is just play it cool, which I know is easier said than done a lot of times. And
Uh-huh.
I've definitely seen a lot where people kind of get in these negative
Cycles.
a little
Yeah,
bit,
yeah.
and it's difficult to say. So I never try to tell that to a patient, but yeah, that's really kind of the zone that I felt. Ideally, right, our relationship to sex shouldn't be one of anxiety, right? And it's
Yeah.
not a snap of the finger, right? You can't just say that to someone, but really, I think that's the ultimate place where our sexuality is the most enjoyable, when it's a place of play, a place of fun. You know, um, Obviously, there's some serious topics around it, but ultimately, I think the most enjoyable, pleasurable expression of it is when there's not huge amounts of anxiety about it, and which definitely, puts pressure, I think, on both partners to grow sometimes, right? Because we always don't see things. We always want, sometimes we want to try things different that the other partner might not, right? But
Right, right. That's normal. If that's you in your marriage, congratulations, you're normal.
exactly, for sure. But I think that's ultimately when I found that things work the best is when anxiety is.
And you can chill out a bit. Just
Yeah,
chill a
exactly.
little bit.
Yeah,
Enjoy this.
yeah, exactly.
Don't be so OCD about it.
Yeah, make it a place of play, make it a place of fun, and yeah. So,
That's great advice. Thank you. If people want to contact you for any reason, what's the best way for them to get in touch with you?
yeah. So like I said, the name of our company is the Male Fertility and Pronies Clinic. So like I said, I've done a lot of just general male sexual health. We kind of focused in on those two for right now. So we primarily see couples that are trying to get pregnant that
Uh,
otherwise aren't. And so we primarily deal with the male side. A lot of female centers out there, a lot of options there. Not very many male
yes,
centers.
male infertility is just as common
Yeah.
as female, but it's not
Oh,
talked
yeah.
about as much.
For sure. Yeah. So a third of the time it's the male, third time it's female, third time it's both. And so anyhow, so we specialize in male fertility, vasectomy reversals, things like that. We also do Peyronie's disease primarily, which is that whole bent penis condition. But so yes, we have a website. It's kind of a mouthful, but malefertilityandproniesclinic.com, vasectomyreversal.org is another one of ours, Peyronie's.com. We actually on that domain too, but
Uh-huh.
that's all our info there.
Very good. Thank you.
Yeah, no problem. Thanks, Dan.
Thank you for listening to today's episode. If you're interested in accelerating growth in your marriage, either sexually, emotionally, or spiritually, I want to invite you to work with me in my affordable coaching program called Next Level. More information about Next Level and my fun and sexy apps for couples are available at getyourmarriageon.com. Please also don't forget to subscribe to this podcast so you don't miss a single episode. And be sure to tell your married friends. I promise, they will thank you for life. Now go get your marriage on.